Good afternoon, students. Our today's topic is typhoid fever. The contents for today's topic are introduction, problem statement, epidemiological determinants, clinical features, laboratory tests, and treatment. Typhoid is derived from Greek ancient word typhos, meaning smoke or cloud. It was believed to cause disease or madness in humans. Typhoid fever is a systemic infection caused by Salmonella typhi, which is a gram-negative bacteria. It's characterized by continuous fever for 3 to 4 weeks. There is relative bradycardia with lymphoid tissue involvement. Commonly termed as enteric fever, it involves not only the typhoid fever but also the paratyphoid fever. Typhoid fever may occur sporadically, epidemically, or endemically. So this is a map showing the prevalence of typhoid fever in the many regions of the world. Like if you see the picture of India, the map of India, it's clearly evident that there is high endemicity, meaning more than 100 cases per lakh per year. Coming to the problem statement, worldwide it occurs in all parts of the world. No part of the world is spared from typhoid, especially in those parts where there is poor sanitation. In 2004, WHO estimated 21 million cases of typhoid fever annually. It kills 216,000 to 6 lakh people per year. 65% of such cases occur in Asia alone and 35% in Africa. Coming to India, the world's largest outbreak of typhoid occurred in Sangli, which is in Maharashtra state, on December 1975. It lasted for around 2 months. This disease is endemic in India, and as on 2011, there were 1.06 million cases and 346 deaths. The prevalence of typhoid fever is 88 cases per lakh population as in 2011. Unfortunately, no much data is collected on typhoid fever, and as such, the appropriate prevalence of typhoid fever is not known. In Southeast Asia, 50% or more of the strains of the bacilli of the strain bacteria has multi-drug resistance. That means they are not sensitive to most of the drugs. Coming to the epidemiological determinants. The epidemiological determinants are dealt under the headings agent factors, host factors, environmental factors, incubation period, mode of transmission. Coming to the agent factor. Enteric fever is mainly caused by Salmonella typhi, which belongs to the family of Enterobacteriaceae. It has 3 main antigens, O, H, and Vi, and there are 80 phage types. Salmonella typhi survives intracellularly in most of the tissues of the various organs of the human host. It's readily killed by heat, pasteurization, and disinfectants. So this is the typhoid bacilli. It's a gram-negative bacilli, therefore this color. It has flagella, as you know that flagellated means that it has an affinity to produce antibodies, and the flagella are peritrichous. So man is the only known reservoir of typhoid fever, and man is a reservoir in the form of case or a carrier. So a case is a one which has the symptoms or which is in the stage of typhoid fever, and the carrier is the one wherein the infection might have subsided or the person might have been asymptomatic, but the bacilli is still present in the human host. So a case is infectious as long as a bacilli appears in stools or urine. Case may be mist, submerged, mild, or severe. Carriers are temporary or incubatory, which excrete bacilli for 6 to 8 weeks. Then there are chronic carriers. They are the ones which secrete bacilli for more than a year, and the organism lives in the gallbladder or the biliary tract. One classical example of carrier is Typhoid Mary. Her real name was Mary Mallon. She was a maid who used to cook food for many families, but she was a typhoid carrier, and through food which was not properly cooked, she infected around 1,300 people at a go. Source of infection is primary and the secondary source. The primary sources are the feces and urine of the cases and carriers. Secondary source is contaminated food, water, fingers, and flies. Coming to the host factors, age. So typhoid fever can occur at any age, and the highest incidence being between 5 to 19 years of age. It's more common in males because males are the ones who are more commonly outside their families, and the carrier rate is more common in females. All ages are susceptible to typhoid fever, and the antibodies for this typhoid fever, like other infection, is stimulated by either the infection or immunization. O antibodies are higher in patients who have the disease, whereas H antibodies are higher amongst those who are immunized. Coming to the environmental factors, typhoid fever is observed throughout the year, the peak incidence being between July to September. It perishes from water within 48 hours, and it survives in ice or ice cream for over a month. In soil irrigated with sewage, the bacilli survives for 70 days under moist conditions and half of the period under dry conditions. It grows rapidly in milk without altering its taste or appearance. Coming to the incubation period, the incubation period of typhoid is 10 to 14 days. It may be as short as 3 days or as long as 3 weeks. That depends upon the dose of the bacilli that is ingested. The higher the dose of the bacilli ingested, the more is the incubation period. Modes of transmission, like I said, it's more commonly present in the feces and urine of cases and carrier. And from there, they are passed through the water, soil, flies, fingers, which are the source to the foods, either raw or cooked, and from the food to the mouth of the well or healthy individual. So from the feces, through water, soil, flies, and fingers, to the food and to the mouth of the individual. Coming to the clinical features now. Like there's an initial stage or stage 1, the prodromal phase, wherein the individual has fever, headache, malaise, abdominal distension. The fever is a typical feeder step ladder pattern type of a fever with more fever during the evenings. It comes and goes, comes and goes. The fever is of that pattern. There is diarrhea, which is pea soup colored, and this stage lasts for 7 to 10 days. That is the first week. Then coming to the second week, during the second week, there is hepatosplenomegaly. If left untreated, then there will be relative bradycardia with rose spots all over the body, which disappear again in 3 to 4 days. Then third week, there can be delirium, disorientation, and if person again is left untreated, there can be intestinal hemorrhage, which can lead to shock, and the person can go into coma. So this is a typical rose spots. These are pink papules, 2 to 3 mm on trunk. They fade on pressure and they disappear in 3 to 4 days. Now coming to the laboratory diagnosis. The laboratory diagnosis is through microbiological procedures, serology, and there are other newer diagnostic tests. Microbiological procedure, blood culture is the mainstay of the diagnosis. Coming to the serology, Felix Vidal test. This test measures agglutinin antibody levels against O and H antigens. Usually O antibodies appear on the 6 to 8 days and H on 10 to 12 days. Now the significant levels are O levels titers are more than 1 in 160 and H is greater than 1 in 320. The newer diagnostic tests are ideal Tubex, Typhidot. Typhidot takes 3 hours to perform. It detects both IgG as well as IgM. The sensitivity is more than 95% and specificity is 75%. Then there is Typhidot M, which detects only IgM antibodies. Sensitivity is 90% and specificity is 93%. Then coming to the control of the typhoid fever. Control of reservoirs, that is the cases and the carriers, control of sanitation and immunization. Coming to the cases, so how can the cases be controlled? If there is an early diagnosis of the cases through culture of the blood and stool, notification, that means any case of typhoid has to be notified, isolation of the cases till 3 stool and urine tests come bacteriologically negative. Treatment, fluoroquinolones are the drug of choice for the cases. Then disinfection of the stool and urine by 5% cresol for at least 2 hours. And follow-up examination of the urine and stool at 3 to 4 months and 12 months after discharge. Coming to the carrier states, identification by culture and serological examination. Treatment, ampicillin or amoxicillin, plus we can give probenecid for 6 weeks. If needed, cholecystectomy can be done. Appropriate surveillance has to be done to identify the carrier state and health education of the masses regarding hygiene, hand washing, sanitation. Coming to control of sanitation, protection and purification of drinking water, promotion of food hygiene, improvement of basic sanitation. Coming to the immunization. Immunization is recommended for those living in endemic areas, household contacts, high-risk groups, and those attending melas and yatras. So the vaccines which are given are VI polysaccharide, which is an antigen of this Salmonella typhi, VI polysaccharide vaccine. It's injected subcutaneously or intramuscularly. It's for individuals more than 2 years. Efficacy is 64 to 72%. Then is Typhi 21A vaccine, which is a live attenuated vaccine. It's not recommended for children less than 3 years. Efficacy is 50 to 80 years. Efficacy is 50 to 80%. 3-dose regime and booster dose after 3 years. Thank you.